Welcome.
All right,
This is
great.
the September first Friday for Innovate AT. And today we're talking with Scott Mullett, and he's discussing the data debate, specifically in athletic training. But then we're going to have a good understanding of how that data then transfers into other healthcare disciplines and just overall healthcare in general. So we'll just jump right in. And Scott, welcome, and just kind of take it from there.
Thanks. Yeah. So thanks again for having me. As Adam said, I am Scott Mullett. I am a Innovate AT community ambassador, but also have my toes in a lot of different areas, particularly focused on data. But my day job, I am an occupational athletic trainer. I have several clients throughout the Midwest, particularly in Ohio and Indiana, where I provide on-site care, and with a few other clients, I have virtual care. So, you have the virtual medicine, etc. But what I want to discuss is how data is important in athletic training, but also extending out to the medical community as well. And if you look at what we have accomplished as a profession, you can see that there's a lot of good things that have happened. But in this day and age of COVID, now we're starting to see the true effects of not having data and what that can do to some organizations. So such as Trident Healthcare no longer providing athletic trainers, New Hampshire hospitals losing millions due to coronavirus, Maryland hospitals cutting salaries. When you have East Carolina University and other universities that are cost cutting, and on and on and on. And this is a very real problem. And as a business owner, I also own and operate AT Efficiency, which is basically a data collection and analysis firm for athletic trainers. And mostly it's just utilizing the data that they provide to me and taking those numbers and putting into a nice, neat report so they can basically provide what they have done to their stakeholders. And that's where I've had success in the occupational setting. But, I've had people come up to me and ask, they're basically scrambling now because now their stakeholders within these organizations, within the college, university, within the hospital setting are asking for hard numbers on where is the value of athletic training, and they don't have it. And that is a problem, right? Because when you look at what we do as a profession is we are there before, during, and after an injury has occurred. We're there during the season, in the middle of the season, and after the season. We're constantly around our patients. And there is a ton of data that we can collect on a daily basis. And I don't think that any other medical profession has access to as much data as we do in our daily practice. But what we continue to see is we're not collecting that. And we are missing out on a huge opportunity and advantage. And this isn't to say that that organizations aren't taking advantage of it. They are, but it's far and few between. And with this, it turns out that, we're not as essential as we thought we were. When they started dropping sports and there were no need for our services, then there were issues within hospital organizations, particularly, that we weren't needed. So people were furloughed, people lost their jobs, sports medicine organizations and departments crumbled as a result of this. And, we're not out of the woods yet. There might be a time in the near future that stuff can occur again, that we will be out again and there will be no sports. So the important part is if we're able to collect this information, we're able to turn this into value, there are other ways that organizations can thrive within their organization. And there are a few out there that have been able to do this and not had to furlough people. And those organizations are great and they're thriving, but there are a lot of organizations out there that are not. Just like, the fact is many programs in some areas will not survive without data to back up their value, as we already alluded to and discussed. So go into a little bit more of my experience with data. And this is a fairly personal story that I'd like to discuss. I started within my major client, so I'm there with them approximately 35 to 40 hours per week. And as a company that I work for, we've been with this organization for probably close to 15 years. And that's pretty good for occupational on-site athletic training. And when you look at the occupational athletic training realm, it's very rare to see organizations that have full-time athletic trainers on site, and myself and my colleague out in Indianapolis do. And, very fortunate to have that. Some organizations such as Amazon have full-time athletic trainers, 40 hours a week. Boeing out in Seattle is another good example. But, when you look at the whole scheme of things, it's rare to have occupational on-site care that I have my own clinic. I have my own times that I schedule with people. So it's very beneficial for organizations. And in that time, I've been able to develop a way to collect simple cost savings. Not only that, but encounter data that I've been able to put into reports for my stakeholders and benefit. So since I've been with this company, every so often we get new management changes. And these are people that are outside even the state that I'm at. And they see that they are employing or contracting athletic trainers and clueless. So in 5 years, I've been under 6 different management changes. And from there, the program has essentially been on the chopping block 4 separate times. And every time we've been able to produce our data, been able to explain our position, and we were able to save the contract 4 separate times. And this is even including at the beginning of COVID-19 as well. So I'm very fortunate that the information that we've collected has been able to save, not only the client, but also has helped us thrive. And to put it into perspective, in 2018, they did a huge corporate slashing, you can say, and the majority of the safety department, which I was under, was cut. So 54 out of 58 people across the country in the safety department and the environmental health department lost their jobs. And because of the information and data that we've collected as a contractor, we were able to stay on. And that is, extremely amazing to be able to come through when, other essential, you would say, safety department, it's extremely essential, environmental department, safe and industrial hygiene essential, and they were all cut, or majority of the people were cut. So from there, I was able to develop policy, some procedures that I in turn provided to different sports medicine organizations across the country, and able to look at their data and provide a positive return for their stakeholders. So comes with this question is a collaboration of everything I've discussed so far. how important is data collection in athletic training? So, as I discussed, it's extremely important as we went over all that information. But for individuals, we hear this all the time. So what do you mean by, we understand data, we get it, we understand the concept. But in some instances, this is like asking somebody, well, why is the sky blue? So what do you mean by data? And, we all know this, facts, statistics collected and analyzed. But for athletic training, it's a little bit different and more specific on what we should be collecting and what's some important information to collect. So breaking this down, and I'm going by settings because every setting is a little bit different, and not all data and information that you collect is going to be important for specific settings. So let's break that down. Looking at our traditional model, secondary schools, collegiate university, performing arts, and we even look at professional and elite level sports. And again, this doesn't encompass everything, and some organizations might be different in what you collect. My advice is when you start to get into collecting information or data, make sure that you're talking to your stakeholders, the people that you report to, and making sure that this is information that they would like to collect. But through experience, through discussions I've had, and through research that I've read through, this is what I feel is extremely important for particularly our traditional settings. So epidemiological data, injury surveillance. So how much exposure is there per day with a specific sport, with a specific team, or at a high school level with a multitude of individuals. And you can get good information from this. So out of every practice, there were, one injury per practice, or, just depends on your information that you're collecting. Or per season, there was X, Y, and Z injuries. And what you can do with this is you can look into, how many knee injuries there were for a women's soccer team. And from there, you can break that down and develop prevention programs as a result. So that's some of the problems and solutions that you can. But within this framework, you're going to need basic information, patient information, sport gender, and this is information that we should be collecting. But with some discussions that I've had with individuals over the past 4 years, it's surprising how much this is not collected. And with everything being electronic, or supposed to be electronic, we really need to rely on our EMRs to input this information in.
Real quick, Scott,
yeah.
and I should have said this before. We want this to be interactive. It's not just a presentation. When you mention that this is what you recommend people, the data collecting, right, what they should collect, and then you just said this is what they are not collecting. What are they collecting? Like, what is the data that they feel is important without talking to their stakeholders?
Yeah, so basically what I've seen is it's just the name and an injury that they're collecting, sometimes a sport, but it's very little information. And from what I've seen, it's a lot of paper-based stuff, and it's just jotting down just a few things, and that's basically it. Or if it's looking at inputting information in notes or tracking, their interactions with individuals, it's very minimal. It's very minimal. So
it's kind of showing that they're busy. It's data that represents, I did today, instead of real data that can be taken to the next level, it sounds like.
Yeah, and in previous presentations, and there will be a few, there's going to be a discussion portion here in a little bit after this section regarding this, but it always comes back to especially for our traditional settings, the time, right? I don't have time to do this. I don't have time to do that. And that, that is understandable. I've been there before. And there really isn't the time in the midst of it. However, if you're able to perform some good time management strategies, i.e., taking notes or getting all the data that you've collected to do before and after it gets busy, then it's much easier to manage. And that's what I've used to do when I was in a traditional setting or a high school setting. At least a half an hour to 45 minutes before or after to organize my information that I've collected and then put it into the computer. And once you get on a good routine with that, it really doesn't take much time and you're able to get a nice flow with it. So if anything, with data that we're collecting, it's pretty much getting into a good routine, as with anything. So yeah, I mean, it's imperative that we're able to input this information and make time out for it. But just to real quickly get through some of this, and then we'll start a discussion session. Cost savings, and I have a question specifically on cost savings that I think we should really talk about, because it's something that has helped me, but others might not see it that way, and I'd like to open that up. But cost savings referral metrics, so looking at a CPT coding cost. I've done it in the past. Is it the best way? We'll discuss a little bit to see if that is actually, is it real money? Is it not? How can we justify this? And then we're going to have a lot of collaboration with safety and HR to obtain some of our metrics, some of our DART, days away, restricted time, OSHA metrics. Injury for our military, epidemiological injury surveillance, and then cost savings. So big thing here is going to be our epidemiological, is what a lot of the military is looking for. But the cost savings factor too, it could play a role, especially if the government is paying, for those contracted services, and the government is huge on ROI, and they want to see that ROI in some form. So, and when we look at like our healthcare admin, rehab and clinic, so our patient reported outcomes is going to be good there, but we also need our clinical outcomes. And, we're all familiar with that, but we should be, those of you in the rehab and clinic area should be collecting some patient reported outcomes, but also, the efficiency of that. And I'll get a little bit more into the efficiency when we talk about the physician practice. The relative value units are basically important for any clinic. So we're looking at the efficiency. So how many people came in that particular clinic, and is there a correlation between athletic trainers helping with the flow of a physician's office by able to seeing individuals, casting, etc., to cut down on the physician's time to see those individuals directly. So that means that physician's office can get more people in, therefore increasing the revenue of that particular office. So let's talk about this because Adam, I know you and I have had this conversation before. So is estimated cost saved valuable information? Is referral revenue? And those of you who need a little bit more explanation, we're looking at the cost saved information is, like I've alluded to before, it's you're looking at CPT codes and you're looking at where you're located, and you can go on, there's several different websites that you can get that information. But say for instance, you can go on cms.gov and you can say, well, here's a CPT code, and this is how much it costs. And if they were to go see a physical therapist, so let's say, I think, it depends on state, but say if it's $80 and this is what it would cost, not including insurance or anything like that, $80 to go on site to a physical therapist, right? So you take that number and you put that into your spreadsheet, and over time you have a report, and you go to your stakeholders and you say, hey, when people come in, with on-site care, this is how much I saved. On the reversal, you have referral revenue, and that's mainly with hospital systems that when you look at some hospital systems, they're paying like high schools to have athletic trainers, to either they even build a stadium, or they have a billboard with that hospital system on it. And one of the jobs of the athletic trainer is to basically make those referrals out to the specific hospital system. And there are pros and cons with that as well. And there's pros and cons with both of these. So when we look at referral revenue, it's, some organizations place quotas on it. And I was associated with an organization that they wanted you to get people who were pregnant and ask them, where are they going where are they going to deliver their baby? And that's kind of a stretch there, and put that into the referral revenue, and they track that, et cetera, et cetera. So Adam, I'll let you discuss a little bit about that. So let's talk about estimated costs saved. So what do you think? Do you think is that real money? Is that important or valuable information? What do you think?
Well, I think you have to look at who the audience is that you're discussing that topic with. If you're a school, they are not spending any money on their student athletes. Mm-hmm. So if you work at a high school, they're not spending any money for the healthcare system. So if you go to a school athletic director or the superintendent and you say, this is how much money we're saving, they're going to say, okay, that's great, but we're not spending any money. So it's kind of a moot point, right? It doesn't really impact that audience. Now, if you talk about we're saving the end user of the system time and money, right? The actual patient, that is a different story. So maybe at a university, if they are paying for the physical therapy, obviously, professional setting, maybe in an industrial setting, if they're having premiums because athletic trainers are working with employees and then they go into the healthcare system. But I think at a high school setting, I don't think it means anything to the stakeholder.
Yeah, and it depends. It really depends who you're talking to or working with. As far as referral revenue is concerned, and those who are listening can discuss a little bit further, but I've had experience with this, as I discussed. But is making referrals, is this ethical? That's something to think about. Is it that there is, and that could be a good ethics question, that if you're working with an individual that in your mind's eye that you can potentially treat there, however, you refer them out to your doc because that there's a certain quota that you have to make to get into the system. And I think that brings up a lot of ethical concerns. But as athletic trainers, we know that referrals are needed many instances and cases. So I think that really comes down to the athletic trainer. But if it's getting towards the end of the month and you need to make a certain quota, and all of a sudden your metrics are looking like towards the end of the month, you're having more people go out. That could potentially bring up some ethical discussion and consideration.
I can chime in here, Scott, if you want, real quick.
Yeah.
On that. Yeah. So sorry if it's a little loud. I'm outside lunging, but what in my experience, kind of on the last 2 points we talked about. Number one, just for the one we're on right now, I completely agree with the ethics question, and it's always been a really, really perplexing thing for me, with because in my head, I've always been in the mindset of, yeah, I'm here at the school to save these kids and their families time and money if I can, right? If I can treat it here, it's going to stay here. Now I've gotten a lot of hot water, especially at my last hospital that I worked for. We never had a particular quota, but they basically like, hey, like you need to get your numbers up a little bit because you're way behind everybody else. But to your point, if I can treat it there, I'm going to treat it there. And if the hospital doesn't like that, that's, I don't know. I mean, I can't just send kids because that's what the hospital wants. On the other point, on the referral, like savings, I'm putting together some data right now for my superintendent at the school, kind of because of what the point I just talked about, to bring me on full time through the school instead of being through the hospital. And although Adam's point is definitely correct, I will say that at this school, I think our superintendent said there are like 30% of the students are in free or reduced lunch. And, I kind of made my pitch of, hey, like my whole goal is to save these families time and money if I can treat them safely and them not need to go anywhere else. And he was all for that because he truly does care for, the kids, and whatever advantage we can give them in-house, we will. So he really loved that. So I think it does depend on the school, the geographical area, the socioeconomic status of the people that you're working with at the high school or whatever level. Because even the school that I worked at before that in Southeast Ohio, very, very rural. I mean, I would have to guess there's probably 70 to 80% of their kids on free or reduced lunch. And I mean, they embraced me within a year because I wasn't sending kids when it didn't need to be sent, you know what I mean? And after I gained the trust of everyone, they loved that because they knew that I was there for them and not trying to make the hospital a quick buck. So I do agree that it's very dependent on the school, district, and scenario. But I think in the right situation, it can make a big difference if you can show them that monetary value that you're saving the families monetarily, and then just with estimated time too.
Yeah, absolutely. I mean, there's a lot of potential, and that's why we're so versatile as professionals, because if you look at it, that when, and I've heard this story several times from different people, and you could vouch for it, and especially in rural areas, and we'll take Southeast Ohio because I'm in Ohio as well, that an athletic trainer might be the only form of healthcare that athletes or that kid is going to get for at least a little while.
Exactly. Yep.
So, there's a ton of value with on-site athletic training, but again, taking Ohio into consideration is most hospital systems will invest to promote their hospital system through the athletic trainer, which I don't really 100% agree with, because there's absolutely no value if you're spending, if you're giving a school X amount of money to have access to their athletic trainer and to put up a billboard or to build a stadium, just so that you could funnel people into that hospital system for reactive care, where you have an athletic trainer who is totally capable of preventative care. So I'll bring up a discussion later about that. So just to kind of get the juices flowing. And here's just an example, and we're taking that cost savings into consideration. And Adam is exactly right. It's going to depend on organizations. If I showed this to a high school that's having the hospital system pay for them, they're going to say, great. Okay. If you bring this to the athletic director, but if you, like I did, presented this to one of my stakeholders in the industrial field, they're doing backflips because they're getting an ROI that's, they were getting the return of $50, per $1 spent on the program. And that's huge. And that's what they want to see. And this is a much larger ROI than I had expected with this particular client. But this is in the industrial and the military setting. This is some of the data and metrics that are important to collect. High school that's not directly paying for an athletic trainer, not so much. High school that is paying for an athletic trainer, like a private school. Yeah, this is good stuff to show them. So we talked about estimated cost savings, valuable information, and it depends. Referral revenue, going a little bit deeper into this. So this is a client that I've worked with, and they've allowed me to share their information. But, this is from 2 schools, and this is great information to show, but that what they've collected. But, is it enough? And in some instances, I've seen, I've heard of financial departments at hospital systems. They say, okay, because this is downstream revenue. And that's one of the weaknesses that we have within this profession is we don't directly generate revenue, which can be an issue with that. So, again, depends. And there's no real clear-cut answer, but this is really to get our juices flowing. But let's focus more on data. I don't want to get too caught up with the cost of stuff because, like I discussed before, there is other information out there that we should be collecting. So our encounter rates. So how many people are we seeing per day? What are those people getting? That's good information that we should collect. And, how we put that into our metrics report is going to be important. So just opening up the floor for discussion, as athletic, and we'll go through these 2 questions here. Are we intimidated by data? And really taking a step back, is this even on our radar during our days? And we've talked about the time constraint, and it's talked a little bit about, time management, but is it intimidation or is it just time? What do we think?
I'll start it.
Sure.
If we talk about the global picture of data, super intimidating for an athletic trainer. Yep. Like you might take stats in college once and then that's it. We're not data researchers. We don't know how to comb data. But I think the bigger issue within the profession of athletic training is there's not a universal system that captures data that then allows athletic trainers to input the appropriate information to have this collective repository of information that shows the value that you're mentioning. So I think until that system is created, nothing is going to change in athletic training, because you literally cannot expect an athletic trainer that works at a high school or even a college setting from NAIA to D1 to figure out how to create a system that captures the data necessary for growth from a financial modeling standpoint. And I just think until no one has created it, no one talks about it. There's a couple platforms on the market, but they really focus on a very specific setting. They don't share information with other, not settings, but other institutions. Mm-hmm. That until we have a system that an individual athletic trainer can input the data from the day, nothing is going to change. So I think that is why the day is long, right? To your second question, the reason they don't do it is that, well, where do I even put it, right? Yep. And there's all these different platforms that don't talk to each other. So I think that is like the crux of the problem of data in athletic training.
Yeah, and if you look at, if you're modeling out of other healthcare professions, is they have access to collect it and then immediately input it into their system. Whereas we don't. So, in the beginning, before I wanted to get into, when I was considering, business, I was oh, software as a service, getting data, getting this. And I saw how difficult and complex it was going to be. So then I just went into consulting. So looking at specifics on a case by case basis and, developing their own model, because let's face it, we're all different. Our state acts are different. Uh, our organization, our hospitals are different. But when you look at nursing or physicians, pretty much it's all the same on what they need to do, how they need to do it. We're all over the place. So that's why it's important to focus on your state and your area and your organization on a case by case basis. And what are your stakeholders' expectations outside of taking care of your patients? So that's something that we also have to think about. Anything else with this?
Yeah, going off Adam's point, I think, and I feel like in a unique kind of space right at this very moment, only because this is the first year that I've had an EMR, which has been, it's just a complete, it's so nice, compared to paper-based I've been doing ever since I was a student.
Yeah.
And so I've been able to really kind of develop at least a system that works for me. To Adam's point, it's obviously not something that can be used at scale. It is mostly just using Google Docs, Google Sheets. But I'm not intimidated by the data collection. And this, again, goes to Adam's point. I have to be completely honest, and, in entrepreneurship and business, talk about strengths and weaknesses. I really don't want to spend any brain power trying to worry about analyzing it. So that's kind of where my hang up is, the analysis portion of the data. So.
Yeah, and to each their own. I enjoy that, but there are a million other people that don't enjoy that. And I like the analyzing aspect of it and learning about that. And, I've only scratched the surface, and it is very, very difficult and intimidating to learn how to analyze. And I've been, independently studying this for about 4 years now. And like I said, I don't think I've even scratched the surface because I'm, going back to teaching to our education, we have very limited in data science and statistics, other than maybe that one course that you had to take. And, as I've gone on and seen how important this is, it's really, it's really worth my time to invest in learning more about it. So we'll just open it up. I think I know a lot of what everyone else is thinking, but those of you who listen and perhaps want to contact and discuss a little bit more, just a little bit of background. I'm chair of NATA's Analytics and Outcomes Committee, and this is roughly one of our questions that we had on a survey that was released at the beginning of the year. We've gotten we got the feedback back from that, and a lot of individuals did not feel that data collection was that important within their daily routine, or did they feel like it would improve their position where they're at. And so the majority of those individuals that responded were collegiate and secondary school athletic trainers. But, opening it up for any further discussion, has anyone seen any improvement based on data collection? Is this important?
I'm going to ask Andrew, just from his unique perspective, coming from data in other industries, listening to truly in-depth pain points of the profession of athletic training. And because you're in the data collection industry, what are your thoughts from what you are listening to Scott mention, and then how other industries have impacted their growth as a profession with proper collection of data?
Yeah, absolutely. So, there's a couple of things that I'm seeing from my perspective. One of them is in an area that we heavily educate on is there's a difference between data and actionable data. And so we have a huge emphasis on actionable data. We learned very early on, if it's just about data and you're trying to provide a system that's going to just give people information, but not help them understand how that information is going to be useful or help drive decision making, and basically letting them formulate some of their own ideas out of that, it can become very overwhelming. It can become somewhat of a challenge, and that's where things like time and effort, can come into play, or those who aren't very data centric don't know what to do. So when you look at things like actionable data, I think that's where you're really simplifying things. You're highlighting key opportunities, key learnings, key trends, key overviews, to where it becomes very simple for someone to identify an opportunity within their team to help keep their student athletes safe. We see that both from an athletic training perspective and working with the athletic trainers that we directly work with, but also with the coaches as well. We, over the years, have gone to a lot of conferences, both NATA and various coaching conferences. And one of the other things that I've really noticed is there has been this influx of athletic trainers and of coaches who grew up more on technology, are more comfortable with technology, and are more comfortable with data. And we are seeing that becoming more apparent in programs in both at the high school and collegiate level, and even dovetailing all the way down to your youth sports as well. I would say then the other area that has been really interesting to see in hearing Scott talk a little bit about the variations of tracking injuries. Texas was one of the first states to implement a centralized database for injury tracking. Here in Washington State, we just recently passed a bill for something very similar. And it's because data is what's going to help us understand the causes and effects of certain things, right? Like I still sometimes am appalled by some decision making where there's really no data that supports a certain decision, but then no data to also track how that decision has been made, right? So whether that's rule changes or whatever the case is. So I think it starts with understanding what data is and how it can be used. And then, and then I think, because it's really different in almost every application.
Yeah, I mean,
That's great.
Spot on.
Great. I have another question real quick, Scott. Again, it's to Andrew, just because the rest of us are all athletic trainers. In the other professions and industries, have you seen that the associations are the ones driving the data, or is it private enterprise who that is their skill set? It's an organization like yours, that's their expertise, and then they work with the appropriate associations and stakeholders to give that industry the information for success?
Well, in my particular market, we specialize in head impact monitoring. And when I go to conferences and I ask coaches, or even in many cases athletic trainers, what are you doing for head impact monitoring? I typically get two responses. One is, what is head impact monitoring? And the second is, we do baseline testing, which tells me that they don't know what head impact monitoring is. So we've taken a really unique approach where we've positioned ourselves as not only just thought leaders, but also educators in the space. And our go-to-market strategy was really about education and awareness. What is head impact monitoring? How should it be used as a resource? And just as important, what is it not? And from that strategy, we've been able to not only grow our business, but also grow the awareness in the market. And, you know, I think it was 3 weeks ago, I got invited by the NATA to do a course on head impact monitoring. And, you know, it's education, it's awareness. And one of the other emphases that we focus on is just really about like what data is and how it should be used, right? I mean, you know, data is not a way to be, it should not be looked at as a way to replace decision making, but it should be used as a way to help drive and empower people to make more informed decisions.
Yeah, absolutely. Yeah.
So I guess kind of a long-winded answer, but I guess to kind of sum that up, you know, it has not been an association-driven approach, but we're starting to get that awareness from these associations, from larger groups who understand. And I always have to say our unique approach, because I think the head impact monitoring space is a very touchy space. You have certain organizations taking certain approaches, and some, you know, are maybe not the most, I don't know if ethical is the right way, but you know, it's simply data and analytics. It's not about a device. It's not about a product. It's about what you do with that data. And so, you know, we've been fortunate enough to have an approach that organizations like the NATA, the CDC, and other, you know, researchers are very interested in, and, you know, continue to use us.
No, that's great. I asked for a very specific point of view from just knowing not the NATA, but knowing the individual athletic trainers, that they always think the NATA should be developing and coming up with every single answer that's important for the profession of athletic training. And I have a different viewpoint on that. So it's great to hear that they are trying to work with you guys who are the experts in this data collection, instead of them trying to create a committee to do it. So that's good to hear.
Mm-hmm. Perfect. So are we reporting to the right stakeholders, you think? And really that depends, but you know, who should we be reporting to? And this is a study that I'm going to look at down the road. And, you know, as Andrew said, we need to utilize data that's going to make better informed decisions for our stakeholders. And that's essentially what we're driving up to. So, you know, and we'll just take general consideration, and we'll look at, you know, maybe we're looking at impact monitoring. You know, would impact monitoring, head impact monitoring be the best to report to our athletic director if you're at high school? Would it be best to report it to a hospital administrator or a superintendent? Or, you know, I think really majority of individuals in the profession are reporting their information maybe not to the right stakeholders. You know, is that the school board? What do we think of that?
I mean, it just depends, man. I mean, there's just like Todd said, he's doing a great job because he's thinking progressively and he's looking at the overall health and welfare of the students. And he's fortunate to have an athletic director that believes in that altruistic viewpoint. So I think every situation is very, very unique. You know?
I would agree. And I think in some cases, people probably don't know who the correct stakeholders are. And I think we're finding with some of these injury tracking platforms or solutions or way people are using them today, there is also a challenge in just flow of information. So yeah, I think I think, and each stakeholder probably has a different point of interest and what's important to them. It's been very interesting to see it from the outside, working with a lot of high schools and then even universities and youth programs, because it isn't centralized, and it changes even from the youth to the high school and high school to collegiate, even by one high school within the same district or one district within the next and one state compared to another. It's an interesting process and convoluted in a lot of cases.
Yep. So, you know, that's it's not going to have a clear-cut answer, and it's going to depend on your organization. But, you know, what I would think is invest in the AT, not a billboard. And imagine we had all the resources and equipment to do our jobs. What if we had, instead of referral quotas or these huge stadiums sponsored by outreach hospitals, what if we had all the equipment that we needed to perform our jobs well? What if we had good data collecting software? And, you know, just as an example, Minitab, I know it's a little bit more extensive than Excel, but, you know, what if we had something that was good at collecting what we have, whether that's a EMR or data collecting software or something on the go, that we're able to get this information into a system? What if our state organizations, like we've already discussed, had, you know, every state had a database that we had everything funneled or connected to? So there needs to be more investment on athletic trainers and what we're doing as a profession, so we are able to collect the information. But really, the whole main thing, and this is a stepping stone in another direction, is our business model. And, you know, if you type in athletic training business model, you're not going to get anything. There's no research out there. There's nothing out there regarding the business model. And I think, you know, the more information that we collect, the more data that we have, is going to help influence a specific business model. And that's our next step. So our next step is developing ways to collect data, how to collect the data, and the data that we can collect, and then developing a business model based off of that. And, you know, we might see this go into different directions, because when you look at the hospital outreach, you know, I don't know if it could sustain within the next several years, especially if, you know, COVID continues to slash, you know, salaries and budgets, et cetera. Or same with athletics departments. You know, it's going to be touch and go. So there needs to be a different approach. And I think the more information that we collect, then we can develop a way and develop additional informed decisions based off of that. But, you know, we'll just open it up. We do have a few minutes left. But Andrew, I definitely need to get in touch with you. Want to talk more about it. So this is my email address up there. Those of you who are listening, you know, what else can we discuss? You know, encouraged to discuss more. Definitely another thing that we need is more research on this. And I'd be more than happy to be a co-investigator on research. I'm already doing it for an individual out at Monmouth, and doing some additional training that we can help your organization out if you're interested in looking at more on the value of athletic training, different utilization of different business models. I'm open for that discussion. So
I just have, sorry, go ahead, Adam.
I wasn't going to say anything. Go for it.
I mean, I just think I have a comment on that last slide where it's invest in the AT. And I think I'm just so surprised in many cases, seeing the programs that we work with or that we talk to, and how under-resourced athletic trainers are to begin with. I mean, we see we see programs in I guess basically 3 different silos. You've got some, and this is generally more at the high school level, where I think you have some more challenges, but you have athletic trainers that are either employed by the school. They probably teach like a sports medicine class. They're there full time. You've got ones that are working for an outsourced third-party organization, PT clinic, and then you have the ones through the hospital. But very rarely do we find a high school program that has more than one full-time athletic trainer. And, to hear about how they have to actually make decisions about, do I go to a away freshman football game, or do I stay at the home JV game? And then that's just looking at one sport. That's not even thinking about the other fall sports that are also taking place. So I think investing in the AT is such an important topic.
Mm-hmm.
And I think that's why we're so empowered at Athlete Intelligence, because you're right. Like if there has to be a balance between effort put into something and the benefit you get out of it. And so, we emphasize so much on just efficient, effective, repeatable processes that are going to provide a high value output of information. And I think that's kind of that, that's that secret sauce of what I'm putting in is going to hopefully help me in the long run. From the outside looking in and seeing how under-resourced and in many cases underutilized athletic trainers are, it's very eye-opening and sometimes concerning. I guess the last thing that I'll kind of comment on that, and was probably some of the most eye-opening, is being at an NATA conference. And I think this was the one in Las Vegas 2 years ago, maybe 3 years ago. But for one, that was when there was a report that came out, just so happened during the conference, that it was like 22% of athletic trainers said that a player was played after an athletic trainer had deemed them as medically unavailable to play, which kind of helped uncover that there is this big disconnect in some cases between athletic trainers and coaches and keeping players safe and winning games. And I'll never forget, some of the customers that we work with came up to us and talked about how we became, and not even so much we as an organization, but the data became this bridge in a gap between how coaches and athletic trainers sometimes make decisions based on feeling rather than fact. Mm-hmm. And so I just think that's another area where data is going to help all stakeholders help make more informed decisions and hopefully help keep players safe, so they're staying on the field and winning more games. And I think that becomes a win-win for everyone.
Absolutely. Yeah. We need to think about the patient. And I believe that percentage was a little bit higher.
Yeah, I think it was too. I thought it was in like the 20s or something. I don't know.
Yeah, but yeah, it's definitely, and it's still, even in 2020, it's still an issue, So, but that's all I have in regards to this. Again, I could probably talk all day about this, but I'd be more than happy to continue this discussion.
Yeah, Scott, that was great. We'll continue with the data overall concept with more content moving forward within Innovate AT. Private conversations will be had, but Absolutely. I think for this first Friday, that's a wrap.
All right.
So once again, thanks to the audience, thanks to Scott, and we'll look forward to the next one.
All right, great. Thanks, guys.
Thanks.
Thanks, guys.
Have a good holiday. See you guys.
That's it.
Yeah.